Well, there you go. We're live, or at least I'm live, but I'm the only one in the film strip. So let's see who's here. It looks like things are working properly. I'm seeing the sound and I'm seeing some guests. So Tracy, I'm going to send you a message to join in with me. Let's see if you get it. And then we'll see if you get to be in the film strip. Hey, Jeanette, can you hear me? Are we live yet for you? Aha, there's Tracy. I'm trying to figure, oh, there's where I hid. No, there we go. I knew there was something I had to do. Can you hear me, Tracy?
I can.
Perfect. Hey, there you are. We're in collaboration mode. So there's two of us here. This is exciting. Our first Hangout. I'm just using the new release of this software, so learning what's going on.
Nice.
This is a casual Hangout. We've got some people in the audience there. Let's see, Paula's there. Let me say hi to Paula. And Janet, Janet, you're in the list. You're here. You didn't come in with your Google or, yeah, I guess your Google account, so I can't get you on camera. But you are there and should be hearing us. We're just going to spend a few minutes here at the beginning waiting for people to come in. This is a networking cocktail party, getting everyone to know one another and finding out who wants to be in the text chat area and who wants to be on camera, or at least with their audio. You don't have to be on camera if you just want to be on audio. Oh, Beth is here. Okay, Beth. So let me send you an invite. And when the message comes up on your screen, just say yes, and it'll bring you into the film strip. If you want to be seen or not want to be seen, just mute the video and it'll just leave your audio alone. So let me send you that message. So it just went out to you. So if you say yes, then you'll come in. And maybe Paula wants to join us in the film strip as well, because I see you there. As I say, this is just a casual get-together, and we'll talk about the issues that all of us here today think are important. It's just a place to hang out, get to know your fellow coaches around the world, where everybody is. We've had some of the people register from Europe, so we've got an international potential audience, although a lot of people are going to watch the replay. Turns out, maybe Tracy, you might know, I was told there was another cancer coaching telephone call going on today at 4 o'clock. I don't know what that is. Do you know what that one would have been?
I know nothing about it.
No?
No.
Well, maybe somebody does. We'll learn where everyone's at and make this a regular hangout for people to come in. There were about, I guess, 30 people who said this was a good idea and why can't they come on out, but they couldn't get it to their schedule. But we'll watch the replay. We are videoing it. So I don't see Beth coming in yet, and I don't see Paula coming in yet. Oh, Beth got killed. I can just see she just dropped out, so she's playing with her computer. You see, Jeanette, if you had your camera, you could join us too and just hang out with us. Okay, Paula, I'll send it again to you. There it went. So you should get the invite on the screen. See if you receive that. And it says you did. So there you go.
All right.
So there we go. Have you met Tracy before?
No, hi Tracy. It's nice to meet you.
Nice to meet you. What's your name, Beth?
Paula.
Oh, Paula. Hi, Paula.
That's Jeanette. Do you like Jeanette or Jen? I think sometimes I've seen you sign your name as Jen. I want to refer to you properly. And Beth, you're there in the film strip. Can you see us? I think you probably stopped the camera. Is your microphone muted or not muted? Oh, we've got Jeanette and we've got Janet. You see, I'm trying to read things as they're going up and down. So Jeanette, you can see everything and obviously hear it in text chat, but you have not logged in with your Google account, so I can't promote you into the film strip that hopefully you're seeing at the bottom of the screen. If you want to just refresh and come back with your Google account, hit the red Google button on the login screen, then you'll be there and I can bring you to the film strip. And Beth, as I say, you're in the film strip. Are you muted? Can you text chat, say you're there or not there? I see you there. It's fun getting everyone familiar with the technology. Well, that's okay. That's okay. Let's see. We've got yellow, so that should be got these two messages. Jen, or let's see who we've got. And on my Mac, it should work on your Mac.
Yep, I'm on a Mac.
You're on a Mac?
Mm-hmm.
Yeah, very few people have done it before. Tracy and Paula are the experts. They've done this. As you've seen them on their regular, or not regular, but their live broadcasts that they've done here, they're familiar with all of this. So we've got the core group and then all these wonderful coaches who are just learning about, hey, there's a new way of talking to one another. Brought the wrong type of webcam. Now I wonder what that would be. I thought a webcam was a webcam. On a Mac. What kind of webcam are you using, Tracy?
It's just built in to my Mac.
Built in.
Yeah, it should be pretty simple.
So Beth is there. I mean, she's in the line. Can you see her picture there, Beth? Paula, can you see Beth in the film strip?
No. Oh yes, I see her photo.
Her photo, yeah. So she's got in a desktop Mac Mini. Oh, I love the Mac Mini. Oh, it doesn't have a camera. Well, that's okay. Does it have a microphone that you can plug in? Then we can have just your audio without the camera. I think my Mac Mini has an audio port. Do you have a microphone? If you're a Mac user, you probably have an iPhone, which has an earbud. Don't some of the iPhone earbuds also have a microphone in them?
I think they all do.
They all do, yeah.
Like even the one you get with your iPod, or like your iPad or iPod, I mean.
So you should be able just to plug it in, Beth, and join us. Well, while we're doing that, the three of us can keep doing the conversation. How is the how is the world? Tell the audience who you each are, because there are some new guests that are in the list, and as I say, we're recording it, so they'll get to see you, and gives you an opportunity to let people know who you are, where you are, and what you're doing. And both of you are in our coaches directory. Yay! We've got people who are in the directory. So let's start with Tracy. Tell us a little bit about what your world is like these days.
Yeah, sure. So hi, everyone. I am a relatively new coach. I've been doing it about a year, a little more than a year and a half about. And I focus on coaching single survivors. And I'm very interested in helping them through the treatment process. But I find that they are usually more ready to work with me during the survivorship phase. So after they finish treatment and are ready to kind of figure out, okay, what does this mean for my life moving forward? How do I date? When do I tell people? What are some of the emotional issues that I'm dealing with? What does my life look like? I wrote a book about my experience called Being Single with Cancer. I surveyed 100 other single survivors to find out what their needs were, what the biggest issues were that they dealt with, and I interviewed a lot of different survivors, single survivors as well for the book. So it has a lot of useful tools and reflection questions and that sort of thing to kind of help people figure out all those pieces, from diagnosis and treatment as the first section to survivorship in the second section, and then beyond surviving, what's next.
And it's a one-of-a-kind, right? You're the leader in the field. I did my research. I couldn't find anyone else who wrote on this topic.
I couldn't either, and that's why I did it. I looked for resources when I was diagnosed because that was my first thought. How am I going to do this on my own? Who's going to take care of me? And I couldn't find anything, so I started some.
And I think you got a lot of not introduction, but a lot of support from Stupid Cancer.
Yes, definitely. And Immerman Angels, I was involved early on with both of those organizations when they started, and so I have a lot of followers in the young adult community as well. And of course, I coach a lot of people, not just singles and not just cancer survivors, but that's my passion, and that's the audience I'm most drawn to serving.
By the way, mark down the word YACC, Y-A-C-C, Young Adult Cancer Community up here in Canada. I was talking to them just before Canada Day. Our big celebration was Wednesday, Canada Day. You're yes. having the 4th of July. So I got them just the day before yesterday, told them about you and your book and your broadcast. So they got really excited and immediately went to the broadcast that you did with me and watched it, and then sent me right back saying, can we share this with other young adults here in YACC Canada? And I said, excellent. For sure, and why don't you give Tracy a call, because maybe she could do a hangout or presentation or whatever, because so they're the 18 to 39 year group, and nice. So they I said, well, they're all on smartphones and laptops, and Tracy's comfortable with video conferencing, so you may not have to fly her up into Canada, but she can still talk to your group. And they said, oh, would she do that? And I said, well, you got to send her an email.
Ask.
Here's right. The introduction. I said, I'm going to be talking to her soon. I'll let her know about you. So
that's great. Thanks, Dave.
They got all excited because you're one of a kind in this particular vertical. And
apparently so.
It's amazing.
Yeah.
And Paula, what's happening in your world? Where are you? I know where you are, but the audience doesn't know where you are.
I'm in South Florida, in Fort Lauderdale, just north of Miami, and I'm a survivor myself, and I've been doing survivorship coaching for about 7 years. I started out kind of focusing on the transition when treatment ends, and now I'm working in that area and also with people who are further out. And kind of like Tracy, I have 2 self-guided journals for patients, one for time of diagnosis and treatment, and then one for the transition into the new normal that is based on the workshop that I do in cancer treatment centers. But it's been, I'm so happy to meet you, Tracy, and to know what you do, because I actually got a call like 2 weeks ago going, I'm getting ready to dating. What do I do? Who do I talk to? And so now I know. So when we get off this email, I'm going to send her your information.
Okay.
And but I do a lot of public speaking. I really enjoy that, and I love doing small groups. I have a 6-week telecourse for women cancer survivors that's coming up again in the fall, and I feel like I've been really lucky to be able to give back and to make a difference for people, because I really believe that, you know, at that transition point when the world has just been turned upside down, and you have to build your life over, even though nobody tells you you're going to do that in the beginning, that coaching is the missing piece. It's the missing piece in how you go from good intentions into sustainable lifestyle changes, and that's what people are looking to do when they're recovering from cancer. They don't want it to come back. So I think we have this amazing thing that we can bring to people, that enables them to just have such a more rewarding and fulfilling life in the wake of cancer than they ever did before, and that's what I think a lot of us are experiencing, for sure. And it's like, let's spread the word. And I also, Tracy, I love the fact that you queried people around the country about the issues. I did that with my journals too, and I think it really made a difference in being able to speak not only to the stuff that I went through personally, but the more universal things. So I'm so happy to meet you. Yay!
Yeah. Thank you.
That's the beauty of what we want to do with the Hangout. I mean, it's not a presentation. We've got presentations coming up the kazoo, and you know, and once a month we all have a theme, you know, that we do bring some guests on and talk about it. But I don't know. I guess I'm very biased. I mean, being a cancer survivor, having gone through the journey on my own, I wish I had known coaches existed. And even when I asked, you know, the psych department in the hospital I was in, they said, no, there are some psychologists, there are some psychiatrists, there's some social workers. Why don't you use them? And I did, and they had some level of support for me, but not what I really wanted. And particularly when I was discharged from the active treatment program, and now the journey really took a different course, because everyone had led me to believe that, well, once we, you know, have cured you, now you can get on with your life. And I discovered that doesn't work. It doesn't work that way. Yeah. And that's when you really want to coach. So I think that's what I'm trying to do with these Hangouts, is get coaches to talk to coaches about what they're doing and get to know where people are, and to create the coach directory, because, you know, I started saying, well, where are coaches? And it's really hard to find you good people. You're wonderful and you're known in your local area, but so many of you, you know, work with people internationally, or not even, just cross provinces or states. And, well, I guess it is internationally if it's Canada, United States, isn't it? So, but you can't find you. So I'm saying, well, let's try to make it, coaches, more visible. Because for those who are watching, you know, I take it as a real compliment. You're just wonderful people. I've had some amazing conversations the last few weeks as I put my foot into the coaching stream and started to meet folks like you. You're all so kind and generous and supportive and heart-centered and want to make a difference. You know, they're all people you just want to go hang out. And you know, Polly even invited me to hang out in her place as a snowbird. I can fly down to Florida now in the winter when we've got 50 feet of snow and 40 degrees below zero, and go hang out in Paula's place. They're all wonderful people. Hear that, Jen? Jen Marshall is here with us today, and she's a Canadian looking after some excellent coaches here in Canada. So, Jen, you see what I'm doing for us Canadians? I'm finding places for us to disappear to in the wintertime.
Well, you know, I live in Colorado, Paula. I would love to come, too. We get a lot of snow here as well.
Hey, if I can come there in the summer, you can come here in the winter, man.
We're having fantastic weather this summer. Very nice.
I would love to be in Colorado.
Well, you have
right
skiing.
now.
We could go to your place for skiing, right?
That's right. That's right. Anyone who wants to ski, you're welcome. And if you want to come in the summer, we got great rivers to paddle on. And I actually lead a canoe trip with a healing theme. And it started off being for single cancer survivors, and now I've opened it up to anyone that wants to come and paddle down the river or be in the healing power of nature and be part of that conversation.
See, these are cancer retreats. This is a business write-off. we can say we're going out there for a cancer retreat, business development purposes, and not a vacation. Heavens forbid, we're not having a vacation.
That's right, totally.
But I mean, it's true. I mean, what's your experience, Tracy, Paula? I know Paula has talked to a lot of different coaches. Tracy has as well. Are you experiencing that coaches are just wonderful, heart-centered people with lots to offer?
Yeah, they're amazing. I mean, there's so many coaches now, right? There are coaches for everything, and you know, sometimes people unwittingly call me a life coach, and there's nothing wrong with that. I think life coaches are great. I have several coaches myself. I call myself a healing coach and a survivorship guide, and Dave really kind of helped me with that term because I've been a river guide for 13 years, and like it's really the same. I'm just helping guide people through the survivorship process. So I'll help anyone with the healing process, whether they're a cancer survivor or not, but I love the terminology of survivorship guide. And I haven't met a ton of other cancer coaches. I've met really one that Dave, I think we're both friends with, Tamber Lee from California. She's amazing. And I love the, you know, certification program that she's a part of, and I have friends who are involved with that, and I have a friend of a friend who's starting a new organization to help more people access coaching. So it'll be a nonprofit coaching model, which I think can be really cool, and he's just in the beginning stages of it. So that's it, though. Other than them, and now you guys, those are the only coaches I know.
Well, I think you're meeting another friend here. Here's a question. I'll throw it up on the screen if I can get it up there. Is it? I guess I got to put me. There you go.
Nice.
Oh, I see what I got to do. I've got to pin myself. Are you having a cancer retreat in September for patients? Jen Marshall here up in Canada wants to know what you're organizing in September.
No, I think she's saying they are organizing something in September.
Oh, they are?
Yeah.
Oh, see?
Having a cancer retreat.
I need more than just bifocals, I think. You know? So they're having a cancer retreat. Hey, maybe we should get all the people who put cancer retreats. Jen, tell us about what you're doing with your retreat in September.
Georgian Bay. I don't know where that is. I bet you do, Dave.
See if I can put that up. There we go.
Oh, that's amazing.
Nutrition and lifestyle.
That's great.
But we are going to have hot dogs and hamburgers, aren't we, if we're going to be on Georgian Bay? I mean, not kale. No more kale, please. This is fun. It's like a cocktail party. Except I can't figure out how to get things. There we go. Get me on the pin.
So, Paula, can I ask you a question?
Sure.
If you've been doing this for 7 years, has it been a sustainable business for you that whole time? Did you do it part-time in the beginning? How did you find your clients?
I did it part-time in the beginning. It's been off and on sustainable, and I've been really fortunate because I haven't had to. My husband has been graciously underwriting my efforts. It's certainly more lucrative now than it was in the beginning. I started out trying to bring the work to patients for free and get the oncology community and nonprofits to pay for the coaching. I was not successful at that, but what ended up working well is creating referral partners within the oncology healthcare community, the nurses and the social workers who get what I can do. So I get patients through that, and then I also from publishing the 2 journals, they were distributed through the Southeast Florida Cancer Control Collaborative to over 500. Each of the journals was distributed for free to 500 people. So I was able to kind of leverage those, like by doing little book groups or 1-hour workshops and kind of bringing people in that way.
That's amazing.
And then referrals from people who know me or know about me.
Mm-hmm.
But I won't deny that it's a challenge, and it's people. people who are further out in the are done with treatment into the survivorship thing are the most likely to engage me for a real coaching package and something big. Some of when I do coaching with people who are on treatment, which isn't that often, I either do like a half-hour complimentary, or I do like a $15 per 15 minute, or $25 per 15-minute thing.
Yep.
And but groups is the way that it's been most successful for me, is doing small groups, small workshops, and
yep.
it's the people that I get paid for those, and then I also have the chance usually to enroll to engage the people in the other work that I'm doing.
Yeah, I'm just starting to do some of that too. Some telecourses as well, just like you, and I should engage more locally with the community, and even my oncologist and my gynecologist who diagnosed me should, I need to reach out to them. I'm sure they have a ton of patients who would benefit from what I have to offer. So those are great ideas. Thank you.
It's my pleasure. My pleasure. I'm so intrigued by what you're doing with the river retreats. That's just often. I have a new partnership with a foundation here, and we did our first retreat. They've been doing the retreats for 4 or 5 years, but the first one that I was in was in April, and it was really successful and really amazing. And that we did, that the foundation funded it, and the people got to attend for free.
That's amazing.
But it was quick. I mean, it filled up like in a week. It was just like, okay, we have our 20 people. And
well, when you can get funding for it, that's, the first 2 years I did my canoe trip, I did it just for single survivors.
Yeah.
And I did everything myself. So I got the company that I guide for to donate the equipment. I got local food and local places to donate the food. We did all of the cooking and shopping ourselves. I got my friends who are guides to donate their time. And, it took 5 months of my life to plan this thing. And I charged $50 really just as a deposit to hold their spot.
Yeah.
And it was a lot of work, and I didn't make anything on it, and then I did it the next year, and we had fewer people signed up, and the week before 6 people canceled. And I didn't know if we were going to have enough people to go down the river, because we need a certain number of boats to fit all of our gear into. So I really decided I can't keep doing that. So that's why I really broadened the audience and the focus, and now we charge for it, but because we charge for it, we don't get as many people to sign up. So it's a challenge.
It's a double-edged, It's such a, and Dave and I have had some conversations about this too. At the point and it's in my experience, the point where the people need it the most, which is when that regular healthcare contact with their healthcare team ends. Yep. They're so not emotionally and psychologically in a place to invest in themselves.
Right.
And they're used to getting everything for free. Right. And there's still free stuff that's in front of them.
Right.
And so I've kind of experienced those same challenges, and then you get I've had situations where I built a relationship with a center and they pay me to do the workshops a couple times, and then but budgets get cut.
Yeah.
And so it's kind of been challenging, and I think that Dave's a perspective of certainly I spent a lot of time trying to focus and engage those people in paid coaching, and I finally just kind of let that go, and I'm focusing more on people further out, like you said, broadening my scope into some things that can work for the cancer patients, or somebody who's just going through something else in life can go through, and that's actually being more successful for me right now than just the straight focus. So.
Yeah.
And it's good for me too, because I tell you, about 2.5 years ago I got really burned out on it.
Yeah.
And I had to kind of step back for about 6 months.
Mm-hmm.
And when I came back in, it was like, wow, this isn't working. You have to face the fact that it isn't working, and so you have to find a new way to approach it. And so I did, because I'm a coach, I did what I would recommend anybody do, is I looked to what was making a difference in my life.
Right.
And I had recently gotten re-involved with some creative things, painting and stuff like that. And so I've started doing some small groups where we play with crayons.
That's awesome.
and they love it. People love
Yeah.
it. I mean, and you know, and if it's, and I'm finding if it's easy, if I'm meant to do it, it's easy. I tell a few people about it. They're like, oh, I like it. But if I'm having to, I'm like, okay, it's not time. It's not the right thing to do right now.
That's such a great way to look at it, Paula. I love that. Because I think we do try to, you know, make things fit or do things that other people say we're supposed to do. But that's great. If you find that it's easy, then do it.
Yeah.
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 You're both bringing up some really interesting information, and I keep forgetting we have about a 35-second delay between what we're hearing each other say here on camera and what the audience actually hears. So I keep looking at the
camera, honey.
Hey, there we go. We've got guests. Whoa! I'm liking this.
I wasn't expecting him
kind of networking.
So how nice.
This is kind of nice.
He's been working like crazy, so being home a little early is fantastic.
So Beth is just bringing up this whole issue of patients. Let's see if I can figure out how to put it back onto camera here. If I highlight it and then bring it up, there it goes. Yeah, it's still there. She says, I totally agree that cancer patients are accustomed to everything for free. And she started doing workshops recently here she's in the Chicago area. But it doesn't say, are you doing paid workshops, Beth? Because that's one of the issues that I'm finding is some people are actually doing paid workshops and paid retreats, and others are struggling with trying to offer a free service and get donations. Those who know me know I'm an entrepreneur. I look at what have I got of value and can I sell it? And every now and then, if some philanthropist comes along, it'd be great to get some extra dollars in order to bring some service without charging for it. But I'm finding that although there seems to be a lot of coaches thinking that it's difficult to get coaching clients to pay and coaching retreats to pay, some are not having difficulty at all. So I'm just trying to read as I talk.
Yeah, I think you're right, Beth. I mean, as soon as I started charging for the canoe trips, it became tougher because, there are a lot of great outdoor programs that are free for cancer survivors, and I've participated in most of them, so I totally benefit from them, and I understand that that's tough. And the other thing, when I started my organization, I toyed with the idea of making it a nonprofit. I ran a nonprofit prior to this that I founded, and after doing that, I decided, no way, am I doing that again? And my dad actually was instrumental in that and saying, hey, your mom and I have started several businesses, but when we start a business, build it up, and we want to move on to the next thing, we sell it. And you can't sell a nonprofit. It's owned by the public. And I see that you put, your blood, sweat, and tears for 6 years into this organization, and you walk away without anything from that. So I was conscious of not being a nonprofit, but then I find that a lot of the nonprofits in the cancer space, too, then aren't interested in working with someone who's, technically for profit, even though I make a heck of a lot less money than the American Cancer Society does. So it is an interesting dynamic that I think we have to try to fit into, and that's part of the challenge.
What is that dynamic? And while I ask the question, I'll throw one out to Jen because I know she'll take 45 seconds before she hears the question. Are you charging for your Georgian Bay retreat, Jen, or is it sponsored? The reason is I started talking to people about would they be willing to pay for services. And 2 weeks ago when we were talking about the Canada Day celebration, I met someone who was putting together a canoe trip in one of our parks about 200 kilometers north of Toronto. And it was for a weekend, and they were charging $550, and they had 14 people who were going on a canoe trip. And he said, we've got lots of people who want to go on adventure canoe trips for the weekend, and we could probably charge more, but we think that's okay, and it's covering our costs and so forth. So I'm getting confused as to why are some people who are not cancer people going out and spending $500 to have some fun out in nature, but those people that are running cancer retreats are saying, oh, no, the cancer patient, they are tight on dollars and they can't spend it, and so they're not going to pay $500 to have a break on the weekend. Am I missing something here? Why do the muggles, as I call them, the people who don't understand cancer, don't live in the cancer world, really are spending money on these kinds of retreats, but when we get to cancer patients, not now an active treatment program, that's different. But once you've been discharged and moving into survivorship, why is there a cost problem in getting people to go off on a retreat?
Well, I think there are two reasons for that, Dave. I mean, one is what you said. You know, that even if they're out from treatment, I've spent thousands, tens of thousands of dollars on my treatment. You know, and again, it's maybe a little different in Canada. Maybe you don't get it because you have nationalized health care, which we don't have here. So it's very expensive, and especially when, like me, when you're single, when you don't have a second income to fall back on. I'm in debt. I'll be in debt for a long time just having paid for my treatment and those extra things. And so that's one factor for sure, and it can hurt someone for a long time after a lot of people in the United States go bankrupt when they get a serious illness or have to have a serious surgery or have an accident because our healthcare system is just not as good. And secondly, there are a million programs, particularly now for young adult survivors, which was an ignored group, an underserved group for a really long time. But now there are a million things. There's True North Treks where you can go hiking. There's Live by Living that does hut trips in Colorado. There's First Descents that does rock climbing, surfing, and kayaking camps for young adult survivors. They do like 60 camps a year. So there's a ton, and they're all free. There's other ones that do surf camps, just surf camps in Maui. I've gone twice with Athletes for Cancer to Maui to go surfing, and it's all free. So when you can get that kind of amazing stuff for free, why would you pay for it? I find that we're a really entitled bunch. We really are, because we could go somewhere every weekend for the next 5 years, and it would be free because we had cancer. And I think it's amazing that all those things exist, and I've taken advantage of many of them myself. But then it makes people less likely, especially in this community that is used to getting everything for free, less likely to pay for it.
That's interesting. Because certainly I've talked to patients on both sides of the border, and yes, money is a big issue if your insurance isn't covering it. And in Canada as well, even though we have a good part of the medical treatment paid for, there are lots of $1,000 a week drugs that you've got to pay for. Maybe you've got a 20% copay, but still dropping another few $100s a week on drugs can certainly affect your budget. But I don't know. I mean, I'm finding that there are people who money is not necessarily an issue. They are middle class. They are upper class. They have savings. They're not being totally wiped out by their chronic disease, whether it's cancer or others. They do spend money, and particularly when they're discharged and they come back into the world, they may have a debt. I mean, it's like, well, I went to university and I've got a $100,000 university loan that I've got to pay off, but hey, that just chugged away and now I'm doing other things. So it may be awkward, but I don't think it's impossible based on some of the people I've talked to who have been able to bring the right value presentation, forward that says, yeah, spend some money on this.
I think you guys are raising some really, really interesting and very valid points, and I agree with everything that's been said, but what I kind of see sometimes in my work is there is a psychological trauma that comes from going through cancer, and that trauma isn't really ever addressed by the medical community in a significant way. And I believe that is contributing to people not being willing to invest in themselves. I mean, so much of my work is done with people that literally they've lost their confidence, they've lost the feelings of self-worth. they've lost the ability to advocate and navigate for themselves, you know, and it's not because it has nothing to do with who they are for their financial situation. It has to do with the unaddressed emotional trauma of the experience. And I also really have to agree with Tracy on the money. I mean, it's so different here. I mean, I've just seen so many families that totally bankrupted. I mean, I think I shared with you on the show, or maybe the other day, I had to have a biopsy done a couple weeks ago. It cost me $1,000, you know, and it's just like, and I have great insurance.
Yeah, me too.
And so money is really an issue here. But it's not the only factor. I think that it's the entitlement, and then the financial part of it. And the whole entitlement thing has been something that I've tried to be playing with some of my treatment center and organizational clients, because, you know, it's an issue. Again, like about a year and a half ago, we had a free workshop, full day workshop, 60 people signed up. It was pouring down, raining, and storming that morning, and 25 of them actually showed up. And so we've been playing with things like commitment fees, you know, and when people come to me and they say, oh, we want to fund our patients to do your telecourse for free, I'm like, I don't recommend that.
No.
Because part of what we're trying to teach them is personal responsibility for themselves and their choices. So you've got to make them pay for part of it.
That's right.
And so the scholarshiping has been a good way, like to have an organization scholarship, do a partial scholarship for stuff. But even then, like I had an offer of that for some people after that last retreat I did, and nobody jumped on it right away. You know, they had a chance to be scholarshiped into my telegroup, and 3 people want to do it, but they didn't want to do it until the fall, and I don't know if they'll do it or not. You know. And I have to respect that that's where they are.
Yeah.
You know, but I think that there's a trauma part component to the reluctance too.
Oh, sure. I think there's so much that goes on in the patient's head. I think of, you know, as some of you know, I spent 18 months in hospital, and it was just a life-changing event where your headspace just goes into some very strange places. And when you come out of it, part of the reason I got into what I'm doing is that I found that the journey from being a person to a patient was difficult, but going from a patient back to a person was even more difficult, because I didn't have my confidence anymore. I had given up all my control and independence to the system, and I hated that because I was a type A kind of guy, and it took me months, took me nearly 3 months entirely to stop fighting everybody and everything that was happening to me in hospital. In fact, they had labeled me on my chart as Mr. Trouble. I mean, I was a terrible patient. It took me forever to adapt into being part of the plan, part of the team to make things happen. But by giving up my independence, by becoming and learning to be comfortable being dependent, by being controlled by everything around me, no longer being able to predict what was going to happen in any given day, not even knowing what was going to happen tomorrow, just changed my head. I mean, I was a totally different person at the end of 18 months, and then I come out, and they said, well, good boy, you succeeded, get out there now and get back into living. And I said, what? I haven't got a clue. My support network is gone, my medical team is gone, my independence is gone, control is gone, my confidence is gone. What am I going to do? And that's when I said, man, who's going to help me? And certainly the social psych departments aren't. I'm not in active treatment anymore, so that's no place. It's now I've got to find a coach. You know, the coach is the one that would have been wonderful in my first year of recovery as I was trying to figure out who I was. In fact, even my chemo brain was still there. I'd be on a telephone call and I would forget who I'm talking to. My whole mind was still foggy. There were just so much readaptation I had to go through to get back to being, you know, a new kind of Dave. And as you know, my handle is new normal. I mean, how do you find your new normal? I think that's where the value of the coach is. Your service is just great, but you've got to be able to charge for it. And where is the money in my case, I went to caregivers. Caregivers are the ones who had money that I could draw upon. And they were the ones who said, you know, I said, why are you giving me a $150 basket of fruit? You know, go get me an hour of consulting time with somebody who's going to help me. You know, why are you spending, you know, $125 on this wonderful robe? I need to take that money and get me another hour of coaching time. You know, it was trying to tell people who had the money, give me cash and don't give me the gift. And I could use that to get people to help me and guide me through the process. So I'm wondering if we can't seem to talk to the patient, because the patient's mind is in adjustment, and you're saying that they don't have any disposable money that they could use for this kind of work. Are there other places other than the governments and the donors and so forth out there that we as coaches can go to get funding to help the patient?
I think that's awesome, Dave. And, you know, a couple things, and Paula, you kind of talked about this too. You know, I do have a wealthy coaching client who values my services so much. She has been willing to offer scholarships, and she'll just give me a lump sum of money and say, use this for other people to access your coaching. And similar to you, Paula, I totally agree. People don't value what they get for free. So I don't ever coach anyone for free. They always have to pay something.
Yeah.
And then her pile of money offsets whatever I would normally charge, and between that and what they actually pay, and then the pile dwindles. And so I think that's a great model. And Dave, what you said, I did early on. You know, first surgery, I said to people, please don't send me flowers. I have this tiny condo. I don't have any room for them. They're gonna, you know, I'm gonna have to do something to maintain them or throw them away, and it's just gonna be more hassle. They're beautiful, but please don't. I'm like, if you have to give me a gift, you know, send a book or a movie or a gift card, and people were great about that. But then the second time around, I actually said, here's what I need. And literally, here are books I would like to read about cancer, about this journey, or ones that have been recommended to me, or I need a new hammock chair for my deck so I can relax and have that time in nature that I appreciate being outside. And I asked for what I needed, and people bought those things for me. So if coaching were a part of that, if people knew earlier on this is an option, you can get some help, there could be a movement for that kind of, even if it was crowdfunded, you know, crowdfunding your coaching, your cancer support.
I mean, I was paying $98 a week for the television in my hotel, my hospital. I call it the 5-star resort. Everybody laughed at me because I hated it so much. But that's $100 a week for watching TV. And the way and that was being paid for again by some of my caregivers. So I'm saying, man, there's coaching dollars. I mean, glad to devote that money to a coach rather than try to watch the next episode of The Young and the Restless.
Yep.
I
mean, there's so many areas here, and Beth is coming in saying she wants to talk to survivors because there's a gap in the support system, and I think everyone has agreed in some of the broadcasts. It's been a common theme that active treatment is where the focus is, and people and the oncology team. Even now, I mean, I'm still in every 90 days due to complications, and I meet my team. I've got a 7-person team that I'm still dealing with. And there is no treatment program. I mean, they're just you're finished. You know, you're not under active treatment. We don't see another operation. We don't see you needing to come back into the hospital. So let's just let you get on with your life. And yet there are a lot of issues that coaches can deal with. And certainly, in some of the coaches I've talked to, their focus has been to go to the hospitals and the clinics and see if they can offer services to people in the treatment programs. And yet the hospital and clinic has their own social psych department that they think that's there to service that need. So I don't want to use an external coach, and particularly if the coach doesn't have medical certification. I mean, that's one of the things that Jen Marshall here in Canada is doing her coaches have medical credentials, and so they are coming into great acceptance into the medical community because they see them as an outreach extension of the psych soc department that can't deal with the overload. I mean, there's so many of us all wanting help, and they don't have enough bodies to deal with it. So the external coach, if they have the right, in their mind, certification. And yet, when I looked at the list of people who are asking for help, they're not all medically related issues. They're not issues that definitely require a social psychologist or a psychiatrist or even a social worker. There are other life issues that a life coach and a certified life coach, because you have to have coaching ability and skills to do it, could offer as a complement to what the clinics and the hospitals are not doing. So I'm wondering if our approach of the coach going to the institution is not understanding not to present themselves as a competitor to what's already there.
No, we get that.
That comes afterwards.
We get that. I mean, I've spent so much time and energy really. How do you build that relationship with the people there? And it isn't about the people who are on the front line working with the patients. They see what coaching can do for their clients, and they're willing to refer, and they're willing to recommend, and they're try to get you in and get you paid. It's when it goes further up the chain and to the director of the cancer center who's going, now why would we do this? We have these people on staff we're paying, and we want them to come into our rehab centers. So it's hard to build a relationship with those people, and then even when you get the relationship where they want to refer to you, their higher level ups won't allow it, and that's happened to me on numerous occasions. And where I think, and I haven't really invested a lot of energy in this so far, but I'm going to over the next 6 months, is the private practices, the large oncology practices, the surgical practices that treat patients, and see, and I have some referrals in that area already, but trying to build that part of it. And sorry, obviously you pushed a little button with me there, but it's not that we're coming in appearing to compete with people, although definitely people are afraid that we are, but certainly me and some of the other cancer coaches that I've worked with, including Tamber, we were very able to diffuse that perception. And especially with the growing body of evidence-based studies and documentation that is credible in the medical community, saying yes, this modality works, and it makes so much sense, especially in the integrated, like you said, the integrated care, the care team, the personalized planning. A coach is I would think as just as important as almost any person in that circle of things. And because we're the gap between good intentions to sustainable changes. But that's hard for the healthcare industry to see right now, is because they have a lot invested in the model that they've been using so far, and it's a new world. I mean, as you've said yourself, Dave, the number of survivors is growing so exponentially all of a sudden as the death rates have dropped, and
the focus of those institutions is on the active treatment. If you've got 2.5 million new active treatment patients coming in, the resource load on the hospital and the clinic is beyond belief. And
and it's only getting worse.
17.5 million survivors, so you're getting a huge multi-million group of people that need help. 2.5 million coming in, not enough resources. So the coach who really does the job of letting people know they exist and have the training and the skills that they need are going to definitely make a big difference. One of the exciting things is the different types of groups, and Jen is one of them, where, and I'm putting it on the screen so the viewers can see it if they miss it in the chat line, is her program that you're going to find at cancercoachprogram.com. It has an extension to the information that coaches could use, and Jen is trying to train people internationally and offer up another layer of services to the community. And people like Beth who have joined in who are saying, gee, I just want to get my practice started. I'm trying to learn how to do it. You know, the coaches are friendly people. They are more than willing to help one another. I mean, I'm not sensing that there's a level of competition that you know, we have. I mean, there's such a big market out there that one coach can help another coach in a different part of the city and not, you know, hurt your own particular market. So coaches are helping one another, and all of you who watch the replay, you know, pay attention to who's here and talk to them, reach out to them. That's one of the reasons why the coach directory is there, so that the email and the website information is available, and you can make contact with other fellow coaches. We're all colleagues trying to help one another and provide guidance and direction. And you know, some people like Paul have been doing it for years, you know, and have years of experience. Some of us are just starting practices and getting going, and we need mentors. We need the guidance and the direction. This community of coaches that we're assembling could become a vehicle if everyone starts to use it, and I hope everyone does.
Dave, I have a question for Tracy before we wrap up today. Tracy, what's the name of your book?
It's called Being Single with Cancer.
Okay.
My organization is called Solo Survivors, so you can that's the website URL as well, solosurvivors.com.
Okay,
if you type
awesome.
it in the text stream, because if it is, I'll get it on camera for everybody, and so that everyone knows, because it's an excellent book. And what I like about it, it's not a book, it's a program. It has work exercises throughout the book, and that was just amazing, because you're able to read the chapter and then do the work around the chapter, either on your own or with a group. So if I was a coach, you know, I would get permission from Tracy, but there's some good material to run a coaching program just around the book itself. It's just an amazing tool. She did such an excellent job. And the book, I'll bring that up right there, is Being Single with Cancer.
Thanks, Dave.
And I know, Paula, if you want to share some of the tools that you have, because you shared them with me, and they were excellent things that you've developed to help your clients. If you're willing, you might want to let other people know you're available to talk about it.
Yeah, the guided journals have a lot of great information, and again, journaling prompts, et cetera, et cetera. And my website, I'll just type in my website. It's what'snextformylife.com. Actually, type here. But yeah, I totally agree that there's so much room for everybody, and so this is like a rapidly growing profession that's going to continue to grow, and the need is going to continue to grow. So
Unfortunately,
it's very, very positive.
Mm-hmm.
Well, I think there's an unlimited potential. I think our mindsets have to be such that we know there's a market and there's a value proposition. And even though there are obstacles, as all of you know, I've been an entrepreneur all my life. So my attitude is, if there's some need out there that I can provide, I'm going to figure out how to do it. And it may be complicated. It may be, you know, some obstacles I have to overcome. But if you network and you learn and you're coming from the heart and you're offering a service of value, you're going to find an audience, and the money follows that serviceable need. So it's getting our head around, yeah, we will do it. It's not maybe as easy as we'd like it to be, but we have extreme value. And speaking as a survivor, I know the value that I would have loved to have connected with, and I'm seeing it all in the people that I've talked to in the last few weeks. So, you know, let's use these Hangouts every week as an opportunity to meet one another, to share our business ideas, to make sure we're in the directory so that everybody out there can find us. And, you know, even if there's only a couple of us here, I mean, there were, as I said, 30 or so people who registered, and they'll be watching the replay. And as people hear about what we're doing, this coaches hangout, you know, may be a good place to get new ideas and move things in the direction we all want it to go. So we're past the hour, and unless Tracy and Paula have some concluding remarks, I'll just pass it back to you and then say farewell to everybody.
Well, I'd just like to say, Jeanette, I just checked out both of the links that you shared, and it's amazing. It's totally the approach that I followed with natural cancer treatment. I love it. I love that you're doing that. I love that there's a National Association for Cancer Coaches. I had no idea, so I'm definitely going to look into that. And please, please figure out how to use a camera next time so we can hear and see you as well. There's some amazing things to contribute, and I want to hear them.
And Paula?
Artist, thanks, Dave, for making this possible. It's so nice to meet everybody. Unfortunately, I haven't been able to see the chat, so I haven't been seeing the chats going through, but I'll figure that out by the next time. And but yeah, thanks for your vision and for making this possible, Dave. Really appreciate it.
Absolutely.
And the chat is in the replay, so you came in the Google side and you didn't come into the Business Hangout side, so that's why you don't see the chat. But you're there in the film strip,
and
okay. You've been on there, but it's all in the
so next time log in through Google.
Oh, sure. Well, I mean, I'll show you how to click through as a presenter, because it's a two-step process. Once you get the invite, you say yes, and then you've got to say yes and then move it back in. But it's all this new technology keeps changing. This is a brand new release of the software, so we're trying to figure it all out, and it's got lots of features. But it allows us to do what we're doing today, just hang out. And there are rare places where that can happen. So I'm glad that this is a way of beginning. This is our inaugural launch. We should have a balloon or something that we have to go off. But we'll be here, at least I'll be here every Thursday at 4 o'clock. And if it's just me, that's fine. If there's one of us, it'll be fine. I got a feeling that it'll grow each week, and we'll have some interesting discussion as people see what we've talked about. I think, from my perspective, that we talked about a lot of really good stuff today.
Yeah.
I think there was a lot of sharing going on. So thanks for being in the film strip, and thanks Beth and Janet and Jen for being there. And thanks to all the people who watch the replay, because you all said that it was something you wanted to participate in some way. So thanks all, and we'll see you again next Thursday at 4. In the meantime, for those in the U.S., have a great Independence Day, a 4th of July. Have lots of burgers and barbecues and beer and water and sun, and stay away from catching melanoma. We don't want any more cancer being developed here on holiday weekends. So thanks all, and see you next week.
Thanks, Dave.
Bye-bye.